Hello, my name is Katrina Wu, and I'm a nurse midwife who teaches in Bethel's nurse midwifery program. As a clinician, my background is primarily in developing women's healthcare services, as well as attending births in the home and birth center settings. I really love midwifery. I love how it places women at the center of their care and really values their expertise in their own bodies and ultimately honors and respects the choices that they make for their health, even as we as midwives come alongside them in helping them achieve their health goals. What initially brought me to midwifery was the opportunity to develop relationships. I love how we can begin seeing women long before they're even thinking about starting a family, and then continue to journey with them through their childbearing years and even into menopause. My favorite time is probably when they're first transitioning to motherhood, and I love being able to be there and empower them as they make that transition. I find the opportunity to build these long-term relationships really professionally rewarding for me. I also really love birth. I find birth to be so sacred, and it is really a continual honor and a privilege to be invited into such an intimate space with women and their families. I've been teaching in this program since we first launched in 2014, and so I've helped to write, develop, and teach in many of our courses. You'll especially find my fingerprints in courses like women's health, newborn care, reproductive physiology, and midwifery perspectives, which is our course that explores the history of midwifery. As an educator, I view myself as a guide and a facilitator. Our students come into our program with a wealth of previous experiences, and I want them to lean into those experiences even as they expand their capability to include the provider role. I really believe that the best teachers our students will ever have are the women in their care and birth itself. So my goal is that while students are in school, I would help to foster that listening ear and passion for women so that they can be lifelong learners who really listen to the women in their care and pursue excellence in their care for women as they stay current and evidence-based. Apart from midwifery and teaching, I love spending time with my family. I have a husband, Andrew, who is a physician in the pediatric ICU, and then we also have a daughter named Symphony. I love to read books with them, and we go for walks and hike and camp. We like to play music together. And then personally, I also love gardening, cooking, and knitting. It's nice to meet you.